A laser pointer is a small laser designed to highlight something of interest by projecting a small bright spot of colored light onto it. Most laser pointers have low enough power that the beam presents a minimal hazard to the eyes for incidental exposure. The laser beam is not usually visible from the side, but it is visible as a result of light scattered by dust particles along the beam path. Laser pointers can be used in educational and business presentations to point things out. Laser pointers can also be used as toys for pets, especially for cats in play. A laser rangefinder is a device which uses a laser beam to determine the distance to an object. The most common form of a laser rangefinder operates by sending a laser pulse in a narrow beam towards the object and measuring the time taken by the pulse to be reflected off the target and returned to the sender. Laser rangefinders may be effectively used in various sports that require precision distance measurement, such as golf, hunting, or archery. Rangefinders provide an exact distance to targets located beyond the distance of point-blank shooting to snipers and artillery. The more powerful models of rangefinders, such as the one shown here, measure distances up to 25 kilometers and are normally installed either on a tripod or directly on a vehicle gun platform.
There are many medical applications of lasers. One of them is called PDT, or photodynamic therapy. It is a treatment that uses a drug called a photosensitizer or a photosensitizer agent and a particular type of light. When photosensitizers are exposed to a specific wavelength of light, they produce a form of oxygen that kills nearby cells. Here is a close-up of a surgeon's hand in an operating room with a beam of light traveling along fiber optics for photodynamic therapy. Its source is a laser beam which is split at two different stages to create the proper therapeutic wavelength. A patient would be given a photosensitive drug containing cancer-killing substances, which are absorbed by cancer cells. During a surgery, the light beam is positioned at the tumor site, which then activates the drug that kills the cancer cells, thus photodynamic therapy. The most important part of using a laser as a weapon is to actually amplify the beam. If you observe the picture, the optical resonator bounces this light between mirrors, forcing more iodine molecules to cough up their photons, further increasing the laser beam's intensity. Extensive testing is performed to further improve the application of the laser being used as an actual weapon. The laser itself isn't hot, but it can heat its target to thousands of degrees. This scene could be coming to a war near you. This is the future of wars right here. The lasers will actually melt the metal, or if it's combustible, it will burn the plane. Here is a visual explanation of how airborne lasers will work.